Good morning, everybody. Welcome to Grand Rounds, our first November Grand Rounds for 2024. Person who is going to introduce Dr. Felicia Hui hasn't arrived yet, so you have me. So Felicia Hui, MD, is a clinical associate professor within the Division of Primary Care and Population Health in the Department of Medicine at Stanford Medicine. She practices clinical work in the inpatient consultation service and outpatient clinic for palliative care. Dr. Hui completed her medical school at Flinders University of South Australia before heading to Connecticut for her internal medicine residency and hospice and palliative medicine fellowship. She is passionate about education, improving communication skills, mentorship, and faculty well-being. These passions are reflected in her various roles, including mentoring learners of all levels, undergraduate pre-med students, medical students, residents, fellows, and early career faculty. She also holds positions as the Associate Clinical Director of Education in the Department of Medicine's Serious Illness Care Program, roles within both the School of Medicine and Department of Medicine councils advocating for clinician educators, past chair of the American Academy of Hospice and Palliative Medicine Wellness, Wellbeing and Burnout Forum, item writer for the ABIM Hospice and Palliative Medicine Board Certification, amongst others. And I see that we have Lisa Rogogupta is here. Hi, Lisa. Lisa brought Dr. Hui to us. So why don't you go ahead and add what you'd like to?
Oh, thank you. I'm sorry, I forgot what a Mac OS software update will do to your computer. But I got on. Welcome, everyone. I'm so pleased to welcome Dr. Hui to our Grand Rounds today. I think that this topic has become increasingly important as a greater portion of our department becomes clinician educators, and as our clinician educators are doing such impactful work here and at Stanford and in the greater medical world across the United States. And so with all of the things that we want to do, all of our high expectations and plans and desires for our careers, we thought from the well-being perspective, it would be a great opportunity to hear some outside perspective on how to navigate a long career. So thank you so much for joining us. I will be accepting questions through the chat or the QA as usual, and Deakin will post those links, or if somebody texts me, we'll be writing, and we'll look forward to hearing your questions.
Great. Thank you so much for that welcome. And I'm very excited to be talking to you guys today about a topic that is very near and dear to my heart and that I feel we don't talk enough about. So the title of today's talk is Stories and Reflections, Advice on Career Transitions for Academic Clinician Educators. And I say clinician educators because it so happened that within my small study, there were a majority clinician educators, and this topic is relevant for anyone working within medicine, whether you're a clinician educator within the professoriate or staff. All right. I don't have any disclosures. So by the end of this presentation, I would like you guys to understand the importance of career transitions, at least from my standpoint, how they affect faculty well-being and professional development. Well-being and wellness are topics I'm very passionate about, and career transitions really came up for me when through my own experiences going from a fellow to first time attending here at Stanford. I'd also like to make sure we discuss common themes that influence the successes and failures of a transition, as well as list the opportunities and challenges of career transitions in academic medicine. So today I want to take you on a journey that really taps into your own experiences while hearing about others' stories. I ask that you think of a transition in your life that impacted you deeply. This could be going to college, graduating from school, any level of school, getting your first training position, starting a new job or position, becoming a parent or losing a parent, or most commonly one that everyone was forced into the COVID pandemic, into and out of it. And as I'm going through this presentation, I want you to think about that transition that you came up for yourself. I never really thought about career transitions or even life transitions. They were sort of just there and part of life. Was there any science or psychology behind them? After my own difficult transition from fellow to faculty, which I'll detail shortly as an example, I went on my own journey trying to figure out what are the most common experiences in a career transition. And being a clinician educator, how did academic faculty like me define a successful transition and a failed transition? My first step was to search literature, something I've learned to lean on, as we all do, when I don't know the answer. Can you guess, and I think this was a few months ago, how many English articles there were in PubMed for the very vague term career transition in the last 10 years? A little over 1,900. I then searched for wellness, also a very vague term, with the same criteria. 3,791,500 results. There were some articles on advice on how to manage a transition, but really not that many on what people actually experience. So let's talk about transitions. I want to point out that a transition is different from a change. A change is something external that happens or an action is taken. Whereas a transition is really the psychological process that involves the personalized and internalized adjustment of emotions and actions. And it can be a really intense transformation. And of course, it takes a balance of many different things. So, leaning on the theories out there, William Bridges had created a very popular model called the Bridges transition model, where ideally a transition would start with something ending. We'll just use my example of my fellowship ending, and then I have time to prepare, and that would be the neutral zone. And then I would start my new job as a first time attending and my new identity. In reality, they all happen at once, which can make it hard to really process everything. I want to dive a little bit deeper. A few psychologists, Adam Hayes and Hobson, they developed this transition curve in the 1970s that really explains the common psychology during a transition. And this normally occurs back in that neutral zone that Bridges had postulated. As I'm going through this transition curve, I want you to go back to that transition you thought about at the very beginning of this talk and see how this curve fits into your memories of what happened. I'll use my example of transitioning from a fellow to an attending to really put this into context. So, I want to point out on the x-axis is time over months, and then on the y-axis is your level of well-being or self-esteem, which can be anywhere as good and as low as despair or distress. So we start off with a life event. For me, that was starting my job at Stanford. you get your first shock with some excitement, maybe some anxiety, but good anxiety. And I have a pretty good high self-esteem. My well-being, I feel, is up there. And this occurs within the first month or so. Then, as you get to learn about your new environment, your new role or position or situation, you go into the provisional adjustment. So this is where I started learning more about my teammates, the actual culture on the team I was on and at Stanford. And things are going really well. It's the honeymoon period. I'm happy. Things couldn't be any better. Then, as I start to learn more and more, I realize there are probably things I don't know or things that I didn't know that aren't so good. And here starts coming the inner contradictions. There's uncertainty. I lost quite a lot of confidence. I was confused. Did I make the right decision? Am I in the right place? I did. I got more angry, which I think I didn't recognize at the time, is that I was depressed, not clinically depressed, but I was in a state where I didn't like what I was doing. Um, to be fully transparent, when I first came, and I realized that the culture on my team wasn't ideal. People said they were unhappy. Again, I wasn't talking to everyone. I was talking to a select few. They were unhappy that the culture was toxic. There was too many expectations on them. They were being overworked. And I thought, great, I know all about wellness and how to form a team. I just learned a lot in my fellowship and residency. I'm going to change the culture here. Into month 4 and 5, I realized that's not going to happen based on one person's ideals. And my self-esteem dropped quite a bit. There's the anger. I felt guilty that I wasn't doing enough, that I was having these contradictions inside of me. And then you might have hit your crisis point. I certainly hit mine. And this was about 6 months in. If this crisis point is actually common in that if you think about intern year, or what we now call junior resident year, you think of December as sort of that black month. That's when you know enough that you don't know enough. And it might not hit the crisis point, but it is your lowest point. I hit that point, and at that time, there were a number of ways that I could have gone, that you could have gone. The first was to stay hostile and think of quitting. I definitely went down that path and thought, maybe this place isn't right for me. I can go somewhere else to change the culture. I'm laughing because I realize now that it is a lot more complicated than that. And changing culture takes a very long time, many, many years in many, many different parts. Can go into an extended crisis, and extended crisis is where you just mull in that level of despair. You can't seem to bring yourself out of it. The situation might be changing, but inside of you, the psychology really isn't. Then another path would be letting go of some of those challenges and feelings and thoughts that you've had, and you have a partial recovery and learning from those experiences. More commonly, we learn to let go, accept our new situation, explore and test, transform ourselves, gain new confidence in our new transition, and develop more self-esteem. So for me, if you look at the x-axis, this says on average, people go through this curve in about 6 to 12 months. I realized that for me, it was a lot longer. It took me a good 2 years, 24 months to go from starting the job here, going through the entire curve. I probably mulled about in that, if you prolong everything, I was about right in terms of my crisis point, being there for a few months or maybe half a year before regaining my self-confidence and doing something constructive out of it. So now, having all that in mind, I want to start sharing the stories and experiences of what I found academic faculty at Stanford and across the nation have experienced. I want to read you this quote. It is a very long quote, but I found it extremely powerful because this was from a participant who was in their late career stage. And it just helped me put things into perspective. I had a career transition where early in my career, before I actually got into my field, where I was initially on a fast track within the VA to become the deputy chief of staff for the whole program. But I had a falling out with my boss, and I went back into clinical care. That was an incredibly painful, difficult transition. And it was seen both by, I think, the VA, but also ABC, and that's this person's institution, as if this was some great disaster on my part. I had been chief resident at ABC. I was sort of a golden boy on the academic track. And so I went back and became a nursing home doctor, which I think many, both in the ABC community and at the VA, saw as a sign of some overt psychosis or something. Nobody but the mad or the insane would ever go and voluntarily work in a nursing home. What's apparent, and so is extremely painful for me personally, was the great paradox. Through that path, I found my way to my passion and love in palliative medicine. So, invoking somewhat of a difficult analogy, after 5 or 6 years in the wilderness, where I became exposed to palliative care, I returned back to the world of academia at ABC and to the VA with this newfound specialty. And it was the best thing that ever happened to me. So it had a certain dramatic quality to it. It was initially a very painful transition. It was both people scorned us, wondering what kind of disaster had happened. It was frankly very tough on me personally. But it turned into really helping me find my passion in the field that I really spent the rest of my life making my career, for which I'm eternally grateful. So, going through my own experience from fellow to faculty, I had a really big question. What are the common experiences in career transitions? And being a clinician educator, how do academic faculty like me define them as a success and failure? So within the Department of Medicine Division of Primary Care and Population Health, I received a small seed grant, about $5,000, to work on this question, which people scratch their heads about and say, how is this important? But they humored me and gave me the grant. So with that, I started creating a very small pilot study. And the eligibility criteria for that was you have had to have had a life change within the last year that affected your career. You had to be an academic clinician, part-time or full-time is fine. And because this was a seed grant within my division, I had to narrow it down to primary care, palliative care, or geriatrics, the 3 main specialties within my division. This occurred back in May of 2017 to 2018. We conducted semi-structured interviews with clinician educators and non-clinician educators, I have to say. Then we transcribed, coded, and analyzed the interviews. So who are the people that we interviewed? 95% were clinician educators. The MCL line does not exist anymore. I believe it's called the UML line, but that's part of the professoriate line. A little over half were female. The average age was 40, and 63% were palliative care. A little under half were at Stanford. The rest were scattered throughout the US. And 2/3 were at the assistant professor or a clinical assistant professor level. There was one who was instructor, and I don't believe that was at Stanford. Okay, so having this in mind, having your own transition in mind, I now want to take you through a number of representative quotes from the stories we heard. The first topic would be the successes and failures for each of the themes that we came up with. But broadly speaking, we also asked people, how do you define a successful transition or a failed transition? Let's start with failure or not so good transition.
A failure is when you jump into something and because of the complexity or because of the fact that you're not really prepared to do it, then it becomes more of a burden or something that you really cannot accomplish rather than something that you're enjoying.
I think a failure of transition is bringing someone into your institution and basically they're not equipped with the tools. They need to be able to perform their fair job, so not only is it something that can lead to burnout for the new hire or isolation or things like that, but also as an institution or an organization. You're essentially losing out on productivity.
So what I'm hearing from these two quotes is that being ill-prepared, feeling like your new change or transition is burdensome, and feeling isolated. Now, let's focus more on the positive and hear how some faculty defined a successful transition.
Also, as part of my career transition, I created my own diagnostic clinic. So that added a lot to my satisfaction, and I created a home visit program once a month with the residents. So that also added a lot to my sense of career transition, and I did this all on my own.
I think a successful transition, as in any transition, has a good amount of pre-thought and planning, has clear expectations and goals. Success for me means is that I don't regret the decision, I made the right decision. And I think that's what makes it be able to label it as a success. It's not about everything's perfect and la-di-da.
I want you to think back to your transition that you have in mind and think, did you have sufficient preparation, clear expectations and goals, feeling like you were engaged and satisfied with your own work? So within our study, we found four major emergent themes: work-life integration, mentors and support, professional development, and research and funding that people experience within career transitions. And with each theme, I want to go through how we defined the theme, if there were any sub-themes that we found, the success within each theme, as well as the failures. Now, you'll have to bear with my voice for the rest of the presentation, as I don't have people or computers reading it. Let's start with research and funding. We define that as the ability to conduct research and garner funding, which are essential to institutional success. We didn't find any sub-themes in this category. So someone here's a representative quote of success. Being realistic about the fact if I took too much clinical responsibility, there's no way I would build a research career. What's funny, and I chuckle at this because this happens a lot, is this person's institution was, how about you just get a clinical job and then do the research for free on top of it? And then a failure would be having that the traditional academic professoriate tends to measure success by things like how many papers you got, what is your grant, how many grants you got, how many peer review journals, how qualified are they, what the status of the peer review journal is. And the half-life of that success externally is incredibly short. Now, I am very disappointed by this, but I also understand the realities that I did this work I started this back in 2017, and I was told recently that that you cannot publish anything that is older than 5 years. I do mainly clinical work. This is all on my own time where, I'm not getting paid for any of this. There's no protected time. So I'm trying to revive it now, but I completely understand this quote that the half-life of the success is incredibly short. You got to keep moving. But I had my own transitions during that time, and my priorities were elsewhere. So that's okay. All right, so let's move on to the next theme, professional development. And we define this as the acquisition of specific skills, knowledge, and behaviors to facilitate success in critical career milestones and functions. There were a number of sub-themes, including imposter syndrome, managing conflict, networking, non-clinical opportunities and roles, time management, work acculturation. And a number of these sub-themes I know Stanford is putting a lot of money and attention to. So let's look at people's stories. First sub-theme we're looking at would be imposter syndrome. I felt this was very relevant. As new faculty, as a woman on the younger end of attendings, it is a little bit challenging to feel like I have something to add to that conversation, and it is somewhat intimidating environment with other non-medicine specialties. I cannot remember which specialty this person was part of. And the sub-theme of managing conflict. Having interdisciplinary team members as a resource who are there all the time than most of the academic faculty has been really, really helpful in learning about cultural tension between our group and this group, and this is how you should approach this. Thinking about my own transition, what I didn't realize was that the few that I was initially talking to definitely had a lot of tension with leadership and the rest of the team. That was within the hidden culture that I didn't know about or see when I first started here. Okay. Next sub-theme is networking. So my boss has been great about actually making connections for me. He's even come with me on a couple, you need to meet so-and-so, let's go. Those have been very helpful. Moving on to non-clinical opportunities. This one's a little less positive. Figuring out what is expected for academic time and how people spend that time. I don't know exactly how or where I want to spend my academic time. And then time management. What I think most clinicians will probably tell you is clinical work always leads into everything else. And so then you're playing catch up the rest of the time. As I was racing out my house this morning at 6 o'clock to get here, I was having an argument with my husband, who is a primary care physician within Kaiser, how I'm on service on the inpatient just once a month. So how can he remember everything he needs to do while I'm busy within the hospital? We were trying to play catch up. Okay, work acculturation. This one's a bit longer. I think for me, challenges are that I didn't have a faculty orientation. And just like the nitty-gritty of how to actually do things that I'm expected to do. Like, well, now that you're faculty, these are your expectations, and we'll teach you how to do what you're expected to do. I must say I didn't have faculty orientation either through the School of Medicine. I didn't get a tour of the hospital. I didn't know the lay of the land. I didn't know who all the team members were. And so I did feel a little bit lost. So overall, within professional development, success would be, people say for the first year, just sort of focus on clinical things and see what's interesting. Flip side, which sounds good and is also hard advice to take at an institution where people are generally very ambitious and always very busy. And a failure would be how people become a medical director or something, or some title change to this. It's really just based on funding deficits rather than who's actually qualified for the job. And that's something that's just totally ridiculous. So in terms of career advancement, I think this person's talking about the lack of transparency. On that note, let's move on to the next theme of mentors and support, which we defined as the resources derived mainly from personal interactions with colleagues, friends, and family, and other tangible resources in the work environment that are critical in successful or failed transitions. There are a number of sub-themes connecting with mentors, mentorship programs, family, collegial support, friend support, and institutional support. So just a few of those sub-themes. Connecting with mentors. This person talks about not having had formal mentors before, that it's actually really helpful and reassuring of setting expectations, making you feel wanted and supported in a way that might not always feel natural to people who are just starting on faculty. So thinking about that imposter syndrome leaking in again. Institutional support. I think Stanford has a lot of resources. It's just that people don't know they're there. And then overall success within mentors and support would be, I think that successful transitions are just made on the people who are there with you during that transition. If you don't have anybody to help you during the transition, you're screwed. I love this quote. I think this quote sort of sums up everything in terms of life, happiness with the Harvard study, as well as transitions. And then failure would be, it makes for a very hard transition if there is no mentor and you feel lost in the ocean. I think it would have been easier if there had been mentors. On that note, let's move on to work-life integration, which we defined as the ability to devote time and energy to both work and life outside of work to feel successful in both realms. There are two sub-themes, anxiety and stress. For anxiety, this person said, I have all these low-level anxieties. Am I doing enough? How should I structure my time? And am I meeting these requirements? And then for stress, I think there are a lot of stresses on me, feeling a little bit under-supported in terms of the amount that I'm actually paid to work, and that creates some challenging home dynamics when the research kind of leaches into home life, and my husband feels I'm not paid for these hours that I'm putting in? What was success for people? Having a lot of departmental support. I'm able to be at home when I'm at home. I'm not just thinking about work all the time, which is great. And then a failure was pretty much the opposite. I feel really aware of the pressures to let work bleed into every aspect of life. And so, one aspect of failure for me would be getting paid an 80% salary to do a 100% job or more. So that was a lot of stories. Putting that all together, if I had to drill it down into 3 main points, it would be symbiosis between work and life, having a strong, supportive advisory group that's made of your family, your friends, peers, colleagues, mentors, bosses, and then feeling like you have a balance and belonging at work. I'm going to take a big breath. If any of you are going through transitions now, I would love to know if any of this resonated with you. And for everyone, the transition that you thought about at the beginning of this talk, if any of that resonated with you. So putting it all together now, successful transitions greatly contribute to one's resilience, whether they're personal and work-related. They all affect one's career. Transitions are strongly influenced by a person's support system. Human connection is key. And then well-being. It's a term that you define for yourself. It does not always mean success or advancement. And there will always be inherent tensions between personal and work-related success during transitions. And striking a balance can help you with your well-being. So what do we do with all this? I do want to point out before going into that, this came from Tate Shenefeld, our Chief Wellness Officer, one of his many articles on the key drivers and 9 organizational strategies to promote engagement and reduce burnout. And within those 9 strategies, 4 of them came up really strongly in our work. Efficiency, resources, workload and job demands, work-life integration. We did hear about some meaning in work, the purple in the middle, and then social support and community at work. So highlighting what we have at Stanford right now, we have a number of offices within Stanford University, the School of Medicine, and within your own department, where 2/3 are CEs and 1/3 are part of the professoriate. We're incredibly lucky, as I've learned, that we are very, very well funded and resourced here at Stanford with Well MD and Well PhD, our Office of Academic Affairs and the Office of Faculty Development and Diversity put in a lot of time and effort to make sure we are doing well with workshops and boot camps. There's a number of leadership programs. The School of Medicine now has a website for new clinician educators with orientation materials, which is so different from when I first started here 10 years ago. PDL, Professional Development Leave, which is our equivalent to sabbaticals, was started in 2004. There's quite a lot of really good work. I loved hearing that within your department, there is an assigned mentor upon hire. So that's really critical. You have a vice chair of promotions, many different mentoring and coaching programs, and then the SNAP program. So being able to network and have that extra scaffolding of human connection. I learned that a couple of you are at the end of, or within your late careers and nearing retirement. So I was looking this up, and there is quite a lot of resources at Stanford within Faculty Affairs or the Office of the Provost, with a very robust webpage of resources. There are many guides and checklists and benefits. And within the School of Medicine, there's also the Senior Academy to make sure you stay connected to your medical community here. So going back to that faculty member who we were talking about, the VA and ABC, I just want to read you his quote. I think for me personally, it's just trying to stay true to myself first and foremost, and not be overly governed by or swayed by a lot of what I see is often rhetoric or a mindset around academic accomplishments at ABC, which I think can cause people a lot of stress. So, some final thoughts. Opportunities for you as an individual. Have strong support from your mentors and those around you. If you don't have more than one mentor, find one. Negotiate for adequate time and energy to spend in different areas meaningful to you. Seek guidance on how to align institutional expectations with your own goals. And you won't know those institutional expectations unless you talk to many different people. And if you want to do research, advocate for protected or paid time. And for the organization, enhance the visibility and accessibility of available resources. Have transparent processes on promotions and advancement. And provide mentoring and coaching for those undergoing transitions, not just those trying to advance to the next role or the next position on the career ladder, but for anyone going through a transition. We have done quite a lot throughout the years here at Stanford, and I have some remaining questions of how do we experience transitions based on our different genders, backgrounds, cultures? How do we measure a program or resource's efficacy? So really going back to that psychological transition curve, it's really building a bridge to give everyone skills to help you cope and not dip all the way down into that crisis point. Every year I give a presentation and have a faculty panel for our fellows. It's entitled Transition from Fellow to Attending. And it gives them some very practical tips on how to prepare for their next stage. This is my Stanford Village. I definitely could not have completed this work and my revival of it without my team and the very quickly growing palliative care village. Those pictures are just getting smaller and smaller over the years as we add more and more people within our own section. So thank you again, everyone, for your time and attention. I hope some of this resonated with you.
Thank you so much. And I love the ending slide here. I think that's how a lot of us feel at some point throughout our transitions and throughout our career. And there were so many really helpful practical tips in there. So I was trying to take my notes for anybody who is in transit and not actively taking notes. Let us know. And I know that we'll post this recording as well. I had one question in the Q&A please, everybody send some more, and I have one separately. So we'll start with the Q&A. As clinician educators, how important is transitioning from assistant professor to a professor during your time at an institution? And what role does mentorship play in that process?
That is a really good question. I'll put my own experience into that. I think it really depends on your leadership and what their thoughts are on that as well. Within my time here, I'm in my 10th year, I've had 2 section chiefs, and the first one, and she was really talking about, she was being the spokespiece, or yeah, for the culture at that time, which is, as a clinician educator, you don't need to get promoted. You will always have a job here. And then when the new chief came, she encouraged everyone to get promoted, given all the good work that you've been doing. On a practical level, what I would say is, at least within the Department of Medicine, I'm not sure how it is in the Department of OBGYN, once you hit year 7 within the assistant professor rank, your salary stays at the same number, not counting for inflation. So with every year, our salary will go up by a little bit based on inflation and the national rates, but it won't have those jumps from year 1 to year 2 to year 3. Year 7 just becomes, it stays stuck there. So that might be a practical way to think about it, to go from assistant to associate to professor. If you want that regional, national reputation, you might want to get promoted. But I have a couple of colleagues who've been working here for 15 years, and they are still at the clinical assistant professor level, and they're extremely happy. I'd like to ask you, Lisa, what is the culture within your department in terms of promotion?
That's a great question. And thanks for sharing. And I'll put out there a reminder to our faculty who don't already know, there was a salary update sent out by our DFA and sent out on a regular basis. And also the School of Medicine has like a School of Medicine salary equity updates panel. I think the last one I have notes on was from about a year ago on how that's structured. So we have like a year in rank structure within our department, but there's lots of other contributions. And I think understanding that salary piece, it's important to understand what are all the contributions to that salary and where do they all come from. But I would say, I like the question and what we're kind of talking about, the difference between, satisfaction with your career and professional development and promotion, that those are sort of 2 separate things. And for some people, being promoted is part of their goals for their professional development and job satisfaction, and for others, it's not. And I think understanding that about yourself is important. The culture here, so we've taken many steps over the last decade to try and have more regular conversations. So for everybody's annual discussion with their chief or section lead, there are structured questions that are available and reminders about sort of the CE requirements set back by the School of Medicine. So kind of taking a pause every year and really reflecting upon what are the things that you want to continue, what are some things that you do not want to continue this year, what are some areas where you can grow. So I think that's really important to take that pause every year because life happens every year. So we're trying to encourage that. And then also, if to your point, one can go up for reappointment or promotion, but having that discussion, and when it's decided that promotion could be on the horizon, could be a potential over the coming years, having conversations with the vice chairs and understanding where one is in that path, where one could make it stronger, and what those opportunities are in the coming years. So I think that that's kind of an important piece. because it, like you said, it doesn't sort of implied, or I guess it doesn't just happen overnight that one wakes up and suddenly gets promoted. But the first step is really understanding whether that is something that you are interested in your next cycle.
Yes. I think what you said really comes down to stay true to yourself. What is your goal? Why are you working here? Why are you working? Why are you a doctor?
Absolutely. We're lucky. We have such satisfying careers and everyday moments, and on a greater scale as well, our impact. My husband, who's also not or is not in medicine, often says we're so lucky because our careers really have purpose and they're not just a job. So I think that recognition is so important. So you kind of talked a little bit about best practices, which was helpful. And as you mentioned, we're trying to bring resources within the department that aligned with your main themes, which I was so excited about: the symbiosis between work and life, how we're trying to support faculty in those transitions and symbiosis, having supportive advisory groups within the department, and feeling of belonging at work. In your research or in your further discussions, have you seen any other examples of best practices that we should be thinking about engaging in the future?
You know, I must say that I was at the relationship recharge weekend this past weekend that the School of Medicine Well MD and Well PhD put on for us. I think I met some people within this department, which was such a joy because I was very excited to. Hopefully, they're here today. That we are very spoiled at Stanford in that we are living the gold standard of wellness and well-being, as well as trying to support each other within the nation. I was talking to someone who was coming from Baylor, and I asked, so what is wellness like there? And she said, it's a really great concept. They agree with it and they're thinking about it. Which I was very taken aback by, because here we have a chief wellness officer who has created very robust programs. And I think a lot of what is being pushed out there is human connection, right? Feeling connected, whether it's feeling connected with your patients, feeling connected to your colleagues, feeling connected to your family and friends. Those are all really important. And whatever you do, whatever your goals are, to always maintain those connections. Hence, I think the recharge weekend, relationship recharge weekend with our partners, but also commensality groups that the School of Medicine has. My division had started their commensality groups a number of years back as well, just to know that everything that we're doing really good work. We're also working incredibly hard. It's intense, it can be really long hours, it can be draining, but there is also opportunity for rejuvenation and for connection. So I think that is something that I just can't emphasize enough.
Thank you so much. And I'll use that opportunity to give a small plug and reminder to those in the department. We are looking forward to organizing our first department retreats coming up in 2025 to be able to get us all together, not just for a lecture, but for like a grand rounds, but really to connect enjoy some professional development and some time together. So really looking forward to that with all of you. 8:26, we made it right on time. If there's no other question, thank you so much to our speaker. We really appreciate the research that you've done here. It was so good to hear what everyone's experiences are, and I think very humbling and reassuring to know that we are all human and we all share the similar struggles, no matter what institution we're at. And a great reminder that we are in a very, I agree, well-resourced institution with a lot of opportunities out there, but it's our responsibility to kind of take that first step and to take advantage of some, or at least advocate or hear about what might be helpful. And that it's a marathon, not a race, and that our careers are long, and we are very used to being a student and a medical student and a trainee in these very short time periods, and that transition throughout your career to these very long timelines that are not necessarily fixed is a different way of thinking. And it's nice to know that there's lots of other resources out there to help us shift. So, and that's a great conversation with the graduating fellows and residents. I'm so glad you do that. And I'm sure there's our education leaders on the line getting great ideas. I think they are already actively involved in similar pursuits. So thank you so much. Thank you, Dakeen, for organizing this all as always. And if anybody has any comments, questions, input, please feel free to reach out as always, and have a good rest of your Monday.
Thank you so much.
Bye, everybody.